Hey there, my name's Lucas. I'm a CRA student going to be taking care of you today. Can you state your name and date of birth for me?
Yeah, my name is Lhebert.Physicalexam. Date of birth is January 1st, 2000.
Good. Alright, so I see in your chart that you've been experiencing a progressively worsening sore throat, a little mild fever over the last 3 days. Can you tell me a little bit more about that?
Yeah, it started a few days ago. Noticed it after class. I was kind of having some difficulty swallowing, some painful swallowing. It's just progressively gotten worse. I also noticed a fever shortly after that. It's gotten as high as 100.9, which was this morning.
Okay. Does your pain radiate anywhere other than your throat?
No, not really.
Does your throat feel swollen or is it causing any problems with breathing?
No difficulty breathing.
That's good. Is swallowing the only aggravating factor?
Yeah, I think I noticed a little bit of maybe enlargement on my lymph nodes.
We'll check that out here in a second. So on a scale of 0 to 10, 0 being no pain and 10 being the worst pain imaginable, how would you rate that pain you've been feeling?
Probably an 8.
Okay. Is there anything that relieves the pain, like any over-the-counter medications?
I have been taking Tylenol 500 milligrams and ibuprofen 200 milligrams, just kind of alternate them as needed. I took the Tylenol last around noon time, so like 4 hours ago.
Okay, gotcha. And so other than those medications, do you take anything else, like just generally? No. Okay. Do you have any allergies?
No.
Any current medical conditions?
Nope.
How about any surgical history?
Nope.
Have you had any other previous hospitalizations for anything significant?
No, I haven't.
Okay. Do you have any psychiatric history, like depression or any other mental health illnesses? Are you up to date with all your immunizations?
Yeah.
What about any other health screenings? Do you see like a primary care physician provider? or anything?
I see my primary care physician annually for just wellness visits, but he told me everything was okay last
Okay,
week.
good. Have you had any significant childhood illnesses that caused you any problems?
No.
Tell me a little about your family history.
My dad had he's got high blood pressure, and then my mom, she's a breast cancer survivor, but she's been in remission.
Oh, okay, cool. All right. Well, I'm going to go dive a little bit deeper into your social history now. Are you currently working?
No, I'm going to college full time.
Gotcha. Tell me a little about your home situation. You married? Live with anybody?
Not married. I still live at home with my parents.
Okay. Do you have any safety concerns with your current living arrangement?
No.
Do you have any history of tobacco, alcohol, or drug use?
I do drink alcohol, about 2 or 3 beers a day, and then smoke.
Do you have any advanced directives like living will or durable power of attorney? Any pertinent life experiences like military or religious beliefs? Perfect. All right, well, that's it for the comprehensive health history. If you don't mind, I'm going to move into the review system. I'm just going to ask you a few brief basic questions. So, have you experienced any weight change, weakness, fatigue, or appetite changes?
Maybe a slight loss of appetite. I think it's just because it swallowed.
Okay. Have you had any headaches, dizziness, swollen glands, or any head and neck stiffness?
I think my lymph nodes are a little swollen.
Okay, gotcha. So that's possible lymphadenopathy. Again, I'll look that in here in a second. Are you experiencing anything else such as vision changes, nosebleeds, or any other pain around your mouth, nose? How about any tinnitus, increased pressure in your ear canals, hearing loss? Any new skin rashes, lumps, or lesions? Any chest pain?
Nope.
Cough, shortness of breath, or wheezing? Diarrhea, constipation, or indigestion? Any increase in frequency, urgency, or pain while urinating?
Nope.
Muscle or joint pain or stiffness? Any weakness, numbness, or tingling?
Nope.
Any heat or cold intolerance or excessive sweating? Have you been bruising and or bleeding easily than usual?
Nope.
All right. You did mention you had fever. Have you had any chills to anything like that?
No chills.
Okay, good. All right, so it's time for me to perform my physical exam now. Is that all right?
Yeah, that's
all right. The patient's vital signs: blood pressure is 118/74, respiratory rate is 18, SpO2 is 99% on room air, heart rate's 102, and his temperature is still 100.9. As for the general observation, he looks great, calm, great attitude. He does appear to be very uncomfortable at times, though, especially when swallowing. So I'm going to go ahead and perform a little neuro exam on you. The patient, I can already tell you're alert and oriented, person, place, time, situation, just off of a previous history. So here's what I'm going to do. I'm going to grab this light here, and I'm going to check your pupillary response, okay? So I'm just going to shine this in your eyes real quick. Pupils are equal, round reactive to light bilaterally. Alright, now I'm going to test your extraocular eye movement. So just follow this finger, keep that head straight. Good. Alright, I'm going to test your arm strength here. Go ahead and stick those arms out. I'm going to push down and you push back against resistance, okay? Alright, we got 5+ strength. So now we're going to do just throw your legs out for me. Let me see that range of motion. Good. Alright, both sides, we got full range of motion. Now we're going to move on to I'm going to kind of assess your head, eyes, ears, nose, throat, all that. So I'm going to go ahead and bring this back out, but I'm just going to look in your ears here. No redness, swelling, or drainage, bilateral ears. Eyes there's no redness in the eyes, no swelling, no signs of infection. There's the absence of any blue or purple discoloration on your nose and your lips, showing that your swollen throat is not causing any difficulty breathing. So now I'm just going to kind of put this back, open your mouth for me and say ah. So the patient's uvula is slightly red. His tonsils are very swollen, very inflamed. He's got some white patches down there. His pharynx is swollen. But otherwise his cheeks and his tongue and his gums all look pink, moist, and intact. So we're going to have to kind of get to the bottom of what's going on with the tonsils there, but we'll go ahead and do that here in a little bit. So next I'm going to just kind of assess your neck. Can you do some range of motion for me? Does that hurt? Is there any tightness, stiffness, nothing like that? All right, good. So here's what I'm going to do now. I'm going to kind of get a little bit closer here. I'm going to go ahead and, actually here, you mentioned lymphadenopathy. Let me check that real quick. Just let me know if I'm pressing too hard, if there's any tenderness.
Yeah, that's a little tender.
Okay, good. All right, I'm not going to do the same thing here. I'm just going to kind of check your pulses bilaterally. So your pulses are great. No signs of JVD, 2+ bilaterally. I'm going to go ahead and listen to those now. I'm going to listen for something called a carotid bruit here. Get on this side. No bruise noted. I can tell I'm just going to kind of push on your trachea here real quick. Just let me know if there's any pain when you do that. Anything? Nothing? All right. Well, there's no deviation, so that looks good. We're going to go ahead and kind of move on. Now that I have these in my hand, I'm going to go ahead and just listen to your respirations and your heart sounds, okay? All right. So I'm going to listen to your breath sounds first. I'm going to start from your superior lobes, go down to your lung bases, anteriorly, posteriorly, and laterally. All right? Here. Posteriorly. All right, lung sounds are clear bilaterally, no adventitious breath sounds. So I'm going to go ahead and listen to your heart sounds here. I'm going to listen to the apex here with the bell real quick. Before I do that, I'm going to palpate this here. This is your precordium. Pulses are strong, or pulsation strong. All right, here we go. Aortic, pulmonic, herbs. We got tricuspid there, and then we got our mitral down here. All right. S1 and S2 heard, no S3, S4. So S3 and S4 are going to be our bad heart sounds. We don't want to hear those, so everything's clear with that. So now that I'm done with that, I'm going to go ahead and just kind of check the pulses here real quick. Make sure we're 2+ strength up here. I want to just double check that we're same thing everywhere. So I'm going to check the dorsalis pedis here. Posterior tibial. You see this right here? Radial pulse is good. Brachial pulse is good. Already checked your carotids. So all pulses are 2+ bilaterally. There's no signs of any skin discoloration, no edema, no ulcers, no varicose veins. Put your hands right out here for me for just a second. Capturing the refill is great in all fingers, less than 3 seconds. All right. So now what I'm going to have you do is I'm just going to have you lay on your back real quick. I'm just going to assess your abdomen. All right, so just based off first inspection, doesn't seem to be any distension. So what I'm going to do now is I'm going to go ahead and also take your abdominal sounds in all 4 quadrants, starting with our right upper quadrant, our left upper quadrant, the left lower quadrant, and our right lower quadrant. Alright, so everything is normal active, and now I'm just going to kind of press down on your abdomen, so let me know if you feel any pain. Back up to the right upper, left lower, and right lower. I don't feel any firmness, no distension, everything's soft and symmetric, so abdomen looks great. And that just about does it for the physical assessment. We're going to kind of get to the bottom of what's going on up here. So I'm going to come back here in just a few minutes and kind of run some tests, draw some blood, things like that. But in the meantime, do you have any questions or anything? All right, well, I'll be back here in just a few.
All right, thanks so much.